Implant failure is rare as long as we have taken all the precautions prior to making the decision to place the implant. An implant is going to replace not just the aesthetic, not just your smile, but it's going to also help you reestablish good function. What we need to evaluate before making the decision of having an implant is checking how diabetes is going, if the patient is diabetic or not, and if the diabetes is well controlled, as healing is an important part of the process. How do you decide which implant is the best for you? Here are some key factors. I'm Dr. Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. So today we're going to talk about the science of ceramic implants versus titanium dental implants. Imagine losing a tooth and discovering that your new smile could be anchored by the same metal used in rockets or by the high-tech ceramic designed for medical perfection. But which is truly the best one for your body and your health and your confidence? Titanium or ceramic dental implants? In this episode, we're going to dive into the science, the story, and the surprising facts behind materials that could change your smile and maybe even your life. So stay tuned to find out which implant might be the perfect fit for you and if you are a good candidate for it. Welcome to our deep dive into the world of dental implants. Today we explore the fascinating science behind two leading materials, titanium and ceramic zirconia. Whether you're considering an implant or just curious about the topic of this video, I will take you into a comprehensive evidence-based look at how these implants work, the history, and what's the latest research reviews about their performance so you can make an informed decision for your health. Let's start with a journey through time. The quest to replace a missing teeth goes back thousands of years. Archaeologists have actually found ancient skulls with seashells, stones, and even carved bamboo inside into joints of primitive tooth replacement options. So people were really creative back then, but we see that the need comes many generations before us. What is a dental implant? I'm just going to show you a model that I brought with me today to help you understand what an implant is before we dive into the history a little bit more. So imagine that you've lost your front tooth and you don't know how to replace it. There are a few options nowadays for tooth replacement, but we still consider implant as the gold standard approach. And what does the implant do? It replaces the root of the tooth. It doesn't rely on the other teeth in order to be set in place, but the root is replaced, which in fact helps with bone formation and maintains the height and the volume of bone in the area. And then on top of that screw, which is the implant, which could be the titanium or the zirconia, we place a false tooth that we call crown. So I just wanted to give you a visual understanding of what implant is, and then the rest of the video is going to make more sense to you. So the modern era of dental implants began in 1960s, thanks to a Swedish scientist called Brennemark. He discovered the process of osteointegration. What is osteointegration? Osteointegration is when the bone fuses around the spirals of the implant and identifies that implant as part of the body. So that's what we call osteointegration. Brennemark experimented with titanium, which led to the first successful long-lasting dental implant. Titanium's unique ability to bond with bone transformed dentistry and set a new standard for tooth replacement. Over the decades, though, titanium implants have helped millions of people regain their smile. But as technology advanced, researchers looked for alternatives, and we welcome an era of ceramic implants, primarily made from zirconia. So these offer a metal-free option for patients seeking improved aesthetics or those who have concerns about metal allergies. So what makes dental implants so successful? It's all about osteointegration. Imagine your jawbone growing around an implant, locking it in place like a natural tooth root. This process is crucial for stability and long-term function. So how does it work? When an implant is placed, bone cells gradually attach to its surface. Over weeks to months, the bone remodels and firmly anchors the implant. Why is titanium so effective then? Titanium forms a thin, stable layer that encourages bone attachment. This was a game changer in the 1960s and remains the gold standard today, mainly because it replaces the missing tooth from the bone up, maintaining good bone function. So bone has fewer chances of shrinking over time, while it also does not rely on the teeth next to it in order to replace the missing tooth, like bridges would do. So what about ceramic zirconia implants? Zirconia also supports osteointegration, which means that the gums and the bone are responding really positively when we look at zirconia implants. What the studies are showing is that the osteointegration rates range from 71 to 83% in titanium, while it's around 64 to 71% in zirconia. A difference that's very small indeed. It's a very small difference when we compare them both, and both are considered very effective. Is there a difference in the healing process though? Some research suggests that ceramic may cause less initial inflammation, but both materials are well accepted by the body and integrate successfully. Before getting a dental implant, it's crucial to have a thorough evaluation to ensure the best possible outcome. Your dentist will assess your overall health, focusing on conditions that can affect healing and the long-term success of the implant. What we need to evaluate before making the decision of having an implant is checking how diabetes is going, if the patient is diabetic or not, and if the diabetes is well controlled, as the healing is an important part of the process. Bone health is equally important, so patients with osteoporosis or taking certain medications that influence the regrowth of bone may create complications for the bone integration, the osteointegration that we were talking before, to take place. So other diseases like autoimmune diseases such as rheumatoid arthritis or lupus can impair healing, particularly if you have immune suppressive drugs in the equation as well. Active gum disease must be treated before implant is placed, because some people believe that a tooth can get periodontal disease, can get gum disease, but an implant can't. But in fact, we do see gum disease and periodontal disease, which we call implantitis, around implants, which increase the chances of an implant failure. The other important factor to take into account is smoking, because we also know that smoking can cause implant to lose stability or even to impair the healing after the procedure has been done. By carefully evaluating and managing these factors, you and your dental team can maximize the chances of a successful, long-lasting implant. The other fundamental factor is to ensure that we have a good quality bone in order to embed the implant. In our practice, we plan every step of the way for when we identify the need to remove a tooth and to have an implant. We don't only just focus on placing the implant, but when the tooth is removed, what are the procedures that we putting in place in order to maintain good bone health and good healing, so then we have strong and good volume of bone in order to place the implant and have the best outcome possible. Okay, so now let's zoom in on titanium implants a little bit more. Titanium is a lightweight, strong, and highly biocompatible material. Its surface can be treated to further enhance bone bonding. And this is an important thing that I want to discuss with you. At our clinic, we focus on the best treated titanium to minimize oxidation, minimize other effects that could take place after the implant is healed in the mouth. So we're looking at the long-term effects of the implant placement. So it's part of things that we want to pay attention to is the quality of the implant. It doesn't matter just it's a titanium and all titaniums are equal. We know nowadays that the way that the surface of the implant is treated changes the long-term results and the long-term effects in the body. Did you know that one of the greatest advantages of titanium is that it has decades of studies behind it. We know the long-term effects of titanium in the body, not just from dental implants, but from other parts of the body and orthopedic surgeries and other procedures that need to use titanium. So we have a very strong data behind titanium implants. And that's one of the reasons why I still like, in some cases, placing titanium implants, especially with those patients that clench, that grind, and we need to have good strength for loading to happen. So titanium implants have a survival rate between 95% and 99.7% over a period of 5 to 10 years. But we still see many implants lasting over 20 years or more. Now, what is the main downside of implants, especially when we're talking about titanium here? In patients with thin or receding gums, we can sometimes see a gray color it's the translucency of the metal implant showing through the gums. So that's one thing that we want to take into account when we're deciding where are we placing the implant. The other consideration is for patients who have allergy to metals. So we need to consider which is the best material in patients who come to us and say, I'm allergic to earrings, I'm allergic to, and we can test these nowadays and find out specifically which type of allergy our patient presents with, and we can tailor the treatment in order to minimize that response from the body. Real quick, your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. So there is a big talk nowadays about metal implants or metals in the body and the electromagnetic field, because we know we are exposed to it more and more in our modern society, and especially with 5G, 4G. So I went deep and looked into the research on this, because I still recommend titanium implants, and I have family members with titanium and patients that we have. We still do titanium implants for them. So I went and looked deep into the research when it comes to EMF exposure and metals in the body. And what the research is showing is that if you keep the implant very close to the cell phone, you can get a little bit of heat happening in the area. There is a little bit of talk about other effects with EMFs, but the research is still very limited, and we haven't seen any significant effect in the body coming from titanium implants. I think we still need to watch this a little bit more and see what the research is going to show us in the future. But at this stage, a lot of research has been done that hasn't given us any significant results for health. So how about metal allergy? True titanium allergy is rare, affecting about 0.6% of patients. So current research is showing that there is a little bit of interaction with the electromagnetic fields, and there's no strong evidence or data to say that everyday exposure to 5G has any harmful effects on your implant or your health. Some studies have explored whether electromagnetic waves could slightly warm the metal or affect healing. But so far, these effects have mainly been seen in laboratory settings and not in real life. For most people, titanium dental implants remain a safe and reliable choice. We definitely need more studies into this though. Now, let's look at ceramic zirconia implants. Zirconia is a type of high-strength ceramic. It's tooth-colored, metal-free and highly biocompatible. Because zirconia is white, it blends seamlessly with natural teeth and gums, especially important in the front areas of the mouth. In regards to the longevity of ceramic implants, short-term studies show survival rates between 87.5 and 93.8%. So it's still a very high survival rate when we're considering zirconia implants. While promising, these results have no long-term data. We can't compare zirconia with implants per se because we don't have the same amount of experience, the same amount of years of use and data when comparing them both. Zirconia is very hard and resistant to corrosion, but it's more brittle than titanium. This means a slightly higher risk of fracture, especially under heavy biting forces. When it comes to how it interacts to your body, zirconia is hypoallergenic and may cause less inflammation in some cases. How do you decide then which implant is the best for you? Here are some key factors. If the implant is in a visible area or you have thin gums, ceramic may provide a more natural look for you. The other factor to take into account is if you have a known metal allergy, then ceramic could be considered the best choice. For patients who grind their teeth or need implants in the back areas where we have a lot of loading, as I mentioned before, maybe titanium should be considered. We only have long-term data, as I mentioned before, on titanium implants. So some patients prefer a metal-free solution because of holistic approaches or lifestyle reasons, and then we know that zirconia is a good option for us nowadays. So always discuss your options with your dentist. We need to check if you are a good candidate for implants, and if you are, which material would be the best material for your case. At our clinic, we do a full comprehensive approach. We take tomographies, which is a 3D scan, to help us evaluate if there's any pre-existing infection on the bone, if the bone has good quality to receive the implant, and if it doesn't, what can we do in order to recover that bone, or what can we do as an alternative to still give back the function that you need for chewing or for aesthetic reasons. Now, to sum up with the questions that I get the most, one of the questions that I hear a lot of the time is that, are ceramic implants as safe as titanium? And yes, nowadays we do have enough research to consider both of them safe when it comes to biocompatibility and healing and osseointegration. Ceramic implants are newer, so there's less long-term data, but short-term results are excellent. Will my implant look natural? Yes, implants look very natural. Both types of implant can look very natural. Specifically select the best type of implant for you and for the amount of gums that you have, how high your smile is, and other things that we want to take into account when deciding the best implant for your case. Can implants fail? So that's a question that I get a lot. Implant failure is rare, as long as we have taken all the precautions prior to making the decision to place the implant. So health factors play a big role, as I mentioned before on the episode. Also hygiene factors and how you're keeping your implant is really, really important. And the other thing that people ask me a lot is how long an implant lasts. Titanium implants, we often see them for 20 years or more. Ceramic implants show promising results with 5 to 10 years, but we need more long-term results. Ceramic implants are quite new when compared with titanium, so we don't have 20 years of studies on ceramic. So should you get an implant? If you lost a tooth, or if you're at the imminence of losing a tooth and you're not sure whether to get an implant or not, I'm going to dive a little bit into this with you to help you make the best decision for your specific situation. So when we look at implants, when we shouldn't get an implant. So when an implant is not an option. An implant is not an option when we don't have enough bone, or the bone had a lot of infection in the past and it's very brittle, very soft. Then there are a few grafting options or other things that can be done prior to an implant, but then it's a very case specific. Considering that the scenario is perfect and you are a good candidate for implants, why should you get an implant? An implant is going to replace not just the aesthetic, not just your smile, but it's going to also help you reestablish good function. What we see is that if we lose a tooth at the back and we start using one side more than the other side, we end up overloading our muscles and our joints on that preferred side of chewing. We've spoken about it in other episodes, but I just want to make this clear for you. It's not just a vanity issue to have an implant, but we're looking at function. And if we have a gap in our mouth, the other teeth will tend to move in order to compensate and close the gap. So the top tooth are going to move if the gap is on the bottom, and the teeth next to the gap are also going to move to close the space. So what we need to bear in mind is that the advantage, and that's why we consider implant a gold standard, it's because it doesn't rely on any other teeth. It doesn't rely on any other structure to be in place, like a plate would do or like a bridge would do. What the implant does, it's a stand-alone solution. It replaces the missing tooth from the bone up, from the root up. So if we look in this model, I've got this example here, right at the front of this patient. And we see that the root is replaced, and then after the healing has been achieved, we have the tooth in place there. This is just a simple example to help you understand what implant is. And then from here, we can have the discussion, what is the best material for you? So dental implants are a remarkable blend of science and art. Whether you choose titanium or ceramic, you benefit from decades of research and innovation. Both options offer safe, effective, and long-lasting solutions for missing teeth. Yes, the electromagnetic field is a reason for concern, and we will need further studies on this. Remember, the best choice depends on your individual needs, aesthetics and goals, and medical history. I am here to help you make an educated decision for your health. Talk to your dentist about it, and thank you for joining us on the scientific journey. We'll see you on the next episode. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.